Welcome to ECHN Healthy Insights, where we talk to clinical and hospital leaders about our programs and services offered to the community. I'm Amy Chandler, the Director of Provider Relations, and today I'm here with Dr. Tricia Hall and Dr. Dennis Burke from ECHN Medical Group, and we're going to be talking today about osteopathic manipulative medicine. Welcome.
Thank you.
Thank you, Amy.
Good.
Nice to see you.
Why don't we start with a introduction, give the viewers an idea of where you're from and a little bit about your experience.
Okay. My name is Dr. Tricia Hall, and I am an osteopathic neuromusculoskeletal medicine doctor, and also board certified in both that and family medicine. And I graduated from the UMDMJ School of Osteopathic Medicine, now the Rowan School of Osteopathic Medicine, located in Stratford, New Jersey. And I graduated from residency here in Manchester, at Manchester Memorial Hospital, where I'm still practicing faculty for family medicine, and then also program director for the Osteopathic Neuromusculoskeletal residency +1.
Great. Dr. Burke?
I'm originally from New York, and I actually went to medical school in New York at the New York College of Osteopathic Medicine. I did my residency at St. Barnabas Hospital in the Bronx. And then since my wife was from Connecticut, I opened up in West Hartford, Connecticut, and practiced there for over 10 years before segueing into some academic positions. So I have an extensive history of working with undergraduate medical students as well as residents. And we needed to come back to the area, so I'm happy to be here at ECHN, and started 5 months ago.
Great. Well, thank you. All right, so let's get into the meat of it. Let's ask the question of what is osteopathic manipulative medicine, and what differs it from traditional medical treatments?
Okay, so what osteopathic manipulative medicine is a term that describes the philosophy behind a treatment approach that is more holistic in nature. So it involves some of our techniques that we call osteopathic manipulative treatment. So with that in mind, the osteopathic manipulative treatment is the hands-based treatment-based, in which we apply our techniques to assess the biomechanical changes that might happen that may contribute to musculoskeletal pain or neuropathies. And the osteopathic medicine, how that's different from the allopathic medicine, is that we're a little bit more holistic in our care and how we approach our patients. So we think of the patient as the mind, body, and soul connection. We view the patient in that holistic approach, and where we intervene, we take special preference towards the musculoskeletal system. So we don't get tunnel vision and pertain to just symptomatic care, but we also take everything and preventative medicine, multiple different treatment models, such as your biomechanical, your neurological, your psychological modules to our approach to treatment of the patient.
Great. Do you have anything to add?
I guess the only thing I would add is that it really is what sets the osteopathic profession apart from the rest of traditional medicine. It's what the profession was founded on. It was a basic premise of structure, anatomy influences the physiology and function of the body. So a lot of times it's pretty obvious that if someone has a significant scoliosis, that their ribs might not move so well, so they can have impact on their respiratory mechanics or cardiac function. So it's looking at that in a really broad application with a lot of different disease processes, that relationship between structure and function.
Right, okay. So keeping that in mind, how do you feel that OMM, osteopathic manipulation, how does that complement the other aspects of osteopathic medicine and preventative care? How do you coordinate with that?
Go ahead.
Okay. Yeah, so basically it's an added tool that a lot of DOs will end up utilizing, or like Dr. Hall and myself, we specialize in it. But a lot of patients, they're getting regular management for their clinical situation, but they need some physical intervention as well. Even if they've had physical therapy, maybe it's not working so well, or they've maxed out on the benefit from it. The osteopathic perspective can be included in that to give them additional benefit, looking at a broader concept of how their physiology is functioning, the respiratory mechanics, how the rib cage may impact that, or how their low back, it may hurt, but it also, when it hurts, it can also affect the nerves that are going to the GI system and affect that. So there's a lot of crossover between the somatic tissues, the musculoskeletal system, and the functioning of the nerves, as well as the breathing mechanics.
Right, kind of like everything is connected in the body,
Exactly.
right? Yeah.
And we take special importance towards the anatomy and how things work, how the body functions.
Right.
So not to become, like we said, tunnel vision.
Right.
And then, not just thinking that the only option is surgery or medications. We try to look at it as there may be, maybe sometimes the body has the ability to heal itself.
Right.
So as a result, that's where we come in, and like Dr. Burke said, the scoliosis, where they're having a problem with breathing. Sometimes, especially if they're older and may not have diagnosed it until later, maybe bracing is no longer an option. But the osteopathic treatments actually may help with their biomechanics to help it function better, and they have a better overall outcome.
Great, great. How does O&M work to alleviate pain and or improve body function?
So it works by removing those biomechanical restrictions, which means that, okay, we have back pain, maybe there's a problem with your lumbar vertebrae that might be restricted. Maybe they have a little bit of arthritis in there that might be limiting their structure and their function. Their function, but they maybe the muscle spasm that might be present, that might be constricting to move, so they can't bend forward, they can't bend backwards, they can't move around much. As a result, where the osteopathic treatments come in, maybe there's a psoas spasm that might be one of those muscles that might be restricting that. So the osteopathic treatment addresses the tightness in the psoas to help them function better and maybe loosen up the restrictions that might be contributing to the lumbar. Sometimes spinal mobilization may be necessary, and occasionally, sometimes when patients have, say, they're associated with numbness, tingling down the leg, in other worlds of medicine, they may just limit as that, okay, maybe you need surgery, but maybe if the osteopathic doctor approaches it, maybe with the spinal manipulation and mobilizing the spine and removing those restrictions, we've unpinched the nerve. And as a result, patients improve, which is what we see in our office. So.
Right. I would assume back issues are probably one of the main things
Very
that
common.
you hear. Yeah, right. It's a very common issue. Yeah. Can you give us an example of how you've used O&M to treat a patient with chronic pain and improve their daily life?
Okay, yeah, so a lot of patients with chronic pain, they're patients we see often, and typically tissues that are tight, they compress blood vessels, they compress nerves, so there's a little bit more pain in that area regionally. But so working on those local areas are important to reduce the overall burden of pain and pain sensing in the body. But with chronic pain patients, they also have something called central sensitization, where there are plastic changes in the nervous system where they perceive pain at a lower threshold. They may perceive non-noxious or typically non-painful stimuli as pain. For instance, if you just put your hand on their shoulder, that wouldn't cause most people pain, but in patients with central sensitization, they may have a lot of pain. So the way you're treating it then is not just locally at the segmental dysfunction, but you have to look more broadly at how the whole neurological system is functioning, and if there's inflammation in the body, how you want to address getting the inflammation to resolve better. And one of the ways that it does that is osteopathically, the way we look at that is through the respiratory circulatory lens, where inflammatory mediators have to be picked up by the lymphatic system in order to be removed from the area. And so the lymphatic system is a type of vessel in the body that drains into the venous system, and these are very thin vessels that are very flimsy, for the lack of another word, and they're very vulnerable to being compressed by tight tissues and areas. So we looked at that whole pathway where if there's inflammation, even if it's an inflamed knee, for instance, that all has to drain up through this left shoulder area into the venous system. And so we're going to look at that whole pattern of that pathway. So
Great.
Yes, yeah, definitely. That's something that, maybe, generally, other places in medicine, other specialties in medicine don't always necessarily address.
Right.
But, for the osteopathic physician, it is important to address lymphatics, which, maybe that forgotten pathway of extra fluid.
Yeah.
So,
Absolutely.
we utilize certain techniques to help mobilize. So that would be, whether opening up those areas with myofascial release, and especially for our more delicate patients, say if they have lymphedema or they have congestive heart failure.
Right.
So for us, I think those are very delicate patients, and then addressing how much we would assess and fix certain of those biomechanical changes that might be contributing to their still having leg swelling. Our techniques are catered towards them, so we cater, either most of those patients, they're delicate, so they're gonna have light, gentle techniques, such as fascial release, lymphatic decongestion. So versus a young athlete might be able to tolerate a much more robust treatment. So we take that into account, the fragile versus the robust, and also what exactly is the problem that's ongoing. If we're concerned about a herniated disc, there's no, we're not gonna go for those much more direct treatments. We'll go about more delicate treatments. And as we said, we're looking at the patient holistically. So if the patient needs a higher level of care, it's not an end all to say that we're not going to include surgery if the patient needs it. We will consult surgery if needed.
Right.
And if there's a patient who has like more of an inflammatory condition, and there's rheumatoid arthritis, so those patients, they will get the full workup. So as the osteopathic physician, we look at that holistically that way too, to try to figure out what's going on with the patient, the root cause.
Right. Part of the care team.
Yep, exactly.
Great. Speaking of those different patient types, are there any side effects or risks associated with OMN that patients need to be aware of?
So, we're osteopathic physicians, so we're fully licensed physicians. So the main thing you want to do is when a patient comes in with a painful musculoskeletal complaint is make sure that you're doing a proper evaluation to exclude anything that would be more serious and not amenable to hands-on manipulation. And if you do that workup, sometimes it comes back that, OMT is indicated, but it's not the primary thing. It would be more secondary, and the patient needs some other things as well.
Okay.
But that's your primary role at that first visit, is to make sure that OMT is indeed indicated. And so we may get a referral, and we may need to do more of a workup.
Right.
But as far as if it is indicated and you do come in for the treatment, even if it's very gentle treatment, there can be some post-treatment soreness, very mild, usually for a day. We just advise patients to drink a little bit more water and not work out on that same day.
Right. Good. Are there any misconceptions about OMM that you would love the general public to know about?
That we are not chiropractors or massage therapists.
Yes.
Okay. Oftentimes, just because those are the available treatment modalities that we're all comfortable, we're all familiar with. So some of the treatment modalities that we utilize in our practice may look similar to that, but not downplaying the chiropractor or the massage therapist. We like to work with them as well, and that there's a part for everybody in medicine as long as it helps the patient overall. So those patients, when we look at osteopathically, we're taking into the whole picture.
Right.
And we also have a wider amount of techniques that we utilize based on what we feel is going on with the patient that we may utilize in care of the patient. So a lot of those treatment modalities would not be limited to, say, for the chiropractor, they're limited mostly to the spine.
Right.
And mobilizing the spine. We do that too, but we also think about all the things that might be causing referral to the spine, and might be why does that dysfunction keep coming back over and over again. Right. And also, what is the underlying issue? Is it an inflammatory? Is it infectious? Is it biomechanical? Is it psychological? Emotional component to it as well. So for the osteopathic physician, misconception that just because we mobilize things that they think it's a chiropractor, but
yeah,
we're more broader than that.
Okay.
But massage therapists, they pertain to more of the most soft tissue mobilization.
Right.
Yes, we do that as well. Some of it can look like, especially when we do some of our lymphatic techniques, but we are more targeted in certain things that we're aiming to accomplish in that treatment. So as a result, that's a couple of misconceptions.
Yeah.
But,
yeah.
Or that say cranial is the be all end all and it's just for a relaxation thing. Of course, it can be used for relaxation too, but when we utilize cranial treatments, we're also trying to treat specific ailments as well.
Right.
So the treatment's usually much more directed than what we, like say, with the physical therapist or someone who's trained in craniosacral, just because our knowledge of it is much broader and our scope of it and what we utilize it for is broader.
Great. Good.
I'd like to address some misconceptions.
Absolutely.
I've been in practice a long time since, let's see, I'd rather not say, but.
You don't have to.
Yeah. You know, most patients think they'll self-refer, or they think the osteopath only really deals with bone or back pain or musculoskeletal pain. There's really a much wider application of what osteopathic treatment can be utilized for. And we see that in the hospitalized setting the hospital I came from at St. Barnabas Hospital in the Bronx, we were consulted for trauma patients, post-surgical patients, postpartum patients, patients who are hospitalized with infectious diseases, whether it was cellulitis in the leg or pulmonary infections. So there's really a broad application of how we can treat our patients. And what we see sometimes in practice as well is a patient who's coming in for shoulder or hip or low back pain, they'll get an upper respiratory infection, sinus infection, and they'll try to cancel their appointment, but I'll tell them, no, come in, we'll do the treatment because we can help with the sinuses and the upper respiratory infection as well.
Right. Well, that's a perfect lead into explaining to the community listening today, when is it most appropriate to reach out for OMM services?
Yeah, definitely reaching out for us is if you have pain. Definitely, we always try to find the bottom line of what's contributing to your pain. If you feel like there's like a mind, especially if you've gone to multiple specialists and say they think that surgery is the answer, maybe just consulting with us or just getting a second opinion is good too. Because as I said, we work with everybody. We refer to surgery as well. If you feel like surgery is recommended, there's a good reason why we're recommending that.
Right.
And we always work with the patient. So if they feel that there's something musculoskeletal, if there is an inflammatory and you're not sure, we can help get to the bottom line of it. We're in Connecticut. Lyme is always something that people come up with.
Yeah.
So we always like to figure out, is it Lyme?
Right.
So
right.
We like to address the whole patient workup.
Great.
A lot of the patients I've seen in my practice of the years were patients that kind of fell through the cracks.
Okay.
They may have had surgery and the surgery went well, but then there was still some residual pain here or there. And so I mentioned earlier that we're looking for areas that are really tight because it compresses nerves, blood vessels. But equally as important are areas that are now hypermobile, and they become very painful because they're unstable. So that can be missed as well by a lot of different people looking at the patient and evaluating the patient. So if you end up feeling like you're not getting the answers, sometimes the osteopathic exam, which is a very comprehensive examination of the structure of the body, can sort out things and give you clues to other things going on. I'll give you an example. A patient comes in, they have a hernia repair, and the surgery went great, the surgeon did a great job, but then 6 months later the patient knows that that ankle starts to swell a little bit. And so nothing wrong with the surgery, it's just now the lymphatic pathways got impacted and you can't drain that leg quite as well. So that's where the hands-on osteopathic work comes in. So yeah, I would just second everything Dr. Hall said.
And do you find that patients in that specific case, those types of cases, require a referral from their primary care in order to see you, or can they just self-refer?
I think most patients self-refer.
Okay, great.
And it would really depend on their individual plan, but most patients can self-refer.
Yeah, great.
Actually, a lot of our practice, they're self-referrals or they're recommended by a friend or family member that we did a great service for in the past. So yeah, self-referred or a community physician who thought that they're familiar with our work and then they thought that we would be the best option for the patient at that point in time.
Right.
So
Great.
the patients that they've been given a runaround, they're just about every workup and there's no answers. We would provide a second opinion.
Great. And you both are available, obviously, as an outpatient service here in Manchester. But can you talk a little bit about your inpatient services for anybody who might end up being a patient in the hospital?
Yeah, so we are a consult service here. So you may see that the attending physicians taking care of the hospitalist taking care of a patient may say, this patient has back pain from being in the hospital bed for so many days, or this patient has pneumonia and I'd like them to get their rib cage moving a little bit better because they have underlying emphysema. Those are great examples of why we would be consulted.
Great.
Yeah, I second that.
Yeah.
Absolutely.
And
it's not only musculoskeletal.
Yeah.
Sometimes we've been consulted for pneumonia, patients that are on the vent. Sometimes the hospital physicians will consult us to maybe help wean the patient off of the vent.
Right.
So,
what about some of our new moms and babies? We know that's a new thing that you guys are going to be doing and we're excited for. Can you talk a little bit about that?
Absolutely. So definitely, so addressing the biomechanical changes that happen with pregnancy, and sometimes patients may have musculoskeletal complaints throughout the pregnancy as the pregnancy is evolving. So as a result, the osteopathic physician will be present to help out with those biomechanical changes as mom progresses through the pregnancy. And sometimes we're available for after they have the baby as well. So postpartum. We're there for the residual musculoskeletal complaints that come on. The fluid retention, the carpal tunnel, all the stuff that comes on afterwards. And then for babies, if they're having any issues with any suckling, feeding difficulties, improper latch, and we're there for them.
That's great. Okay, well, we appreciate your time today, and we just want to make sure that the community realizes that you can access these providers here in Manchester. If you're interested in finding out more, you can go to ECHN.org, check out the services, request an appointment, and we thank you again for being here.
Thank you, Amy.
Thank you, Amy.
You're welcome.